Patients have, some factors for delirium that are risk factors for delirium. They come with themselves, like obviously older people, someone that has, been a moderate or high drinker of alcohol. So there's things that, patients come to the ICU with, but then there's many factors that we introduce in the ICU that will perpetuate delirium, or there's things that happen to the patient. And so it's really, really important on a daily basis to think about what are the risk factors that the patient has for delirium. There's a really good systematic review that I published with a Dutch group, and it's a head of press in critical care medicine, and we really systematically looked at these factors because it's a large literature, and to be honest, some of the studies aren't that great, so we really helped rate the level of evidence and came up with some really key factors. And one of the biggest ones is really avoidance of oversedation. Certainly benzodiazepine use is associated with a greater incidence of delirium compared to other sedatives. So there's certainly some important risk factors that pharmacists can identify in their patients and talk to the team and reduce some of these risk factors. And that should really be done on a daily basis. The whole pain, agitation, delirium arena should be talked about with the interdisciplinary team, and certainly involving the nurse, really on a daily basis, because it's a very dynamic process. It changes over the ICU stay, and it's not something that can just be, like the plan you have on the first day of the ICU stay is generally not going to be the plan on the fifth day of the ICU stay, for example.